sports medicine physician, and today I'm reacting to the worst broken bones stories, the Tombstone Edition. Someone sent me a link to a whole bunch of the worst broken bone stories on Reddit and asked me to react to them. So that's what I'm gonna do. If you guys like these reactions, I'll do more. And if you have your own worst broken bones story, leave it in the comment section down below and I just might react to yours. If you're new to the channel, be sure to subscribe and hit the notification bell. If you're a returning member of the intern army, you know what to do. Go smash the like button.
Okay.
Share this bad boy with a friend. If you have a specific question that you want me to talk about, then be sure to catch me on my live stream at 7 p.m. Eastern Standard Time every Sunday evening. With that being said, let's get to the broken bone stories. And today's broken bone story comes from Timmain, who writes, "When I was 4, I was a very precocious child. I climbed everything I could get my little hands on. My father was a lineman for a regional power company. Since I wasn't old enough for preschool, that summer he took me out when he was working. This particular day, my dad was working around an old cemetery. When he was working, I decided I was going to start climbing tombstones. Most of them were pretty lame, short and easy to climb on top of. But then I saw it. A concrete spire, 4 feet tall, the tallest tombstone in the graveyard. I had to climb it. So, while Dad was busy, I went over and started to get a grip on the pointed top of the stone. What I didn't know was that the 300-pound spire was almost 100 years old and standing on a simple concrete pad. The mortar that held the spire to the pad had eroded away and the spire was just barely standing upright. As I got my hip on top of the spire, the mortar gave way and the 300-pound concrete spire toppled on top of me. The top of the spire hit me a few inches below my hip, which was lucky. A shattered hip would have been far, far worse. And the body of the stone landed on my right knee and the tips of my toes on my right foot, which snapped my leg in half below the knee. Massive compound fracture, bleeding hard, tremendous pain, all trapped under 300 pounds of concrete. My father always will be my hero because as soon as he heard me start to scream, and let's face it, if you break your leg in half when you're 4, you're not going to be stoic about it, you're going to scream like your life is over. He ran over and, in adrenaline surge, picked up the block and threw it about 5 feet away. He told me years later that he completely whacked out his back doing this and was unable to walk for days afterwards. He tied a tourniquet above my knee and carried me to his work truck and he drove me to the nearest hospital. When we got there, I was placed in traction and shot full of morphine. I didn't walk again for over a month and had another 6 weeks of PT after that. The scar from the compound fracture at the time went 3/4 of the way around my leg. Even now, 35 years later, the scar covers the entire front of my right shin and is completely devoid of nerve endings. The muscle that runs down the front of my shin was deformed and maintains a comparatively huge dent even to this day. Yeah, that sounds like it was pretty bad. Some people might say that this isn't real, that this was maybe fake. Although he was quite descriptive and he was only 4 at the time, can't know for sure exactly how much of this was accurate and how much of this he's getting secondhand from his father or whatever. I don't know exactly how much a 4 feet tall concrete spire would weigh. I would guess that it would probably weigh at least 300 pounds, if not more. If that was something that fell down on a 4-year-old child, that would result in the compound or an open fracture such as he describes. I would probably imagine that it would cause a significant crush injury. So the fracture probably be a comminuted fracture. I would guess that this would probably have been what we would call or describe a Gustilo 3 open fracture. And by that, I mean that the wound where the fracture, where the bone had come out through the skin would be at least 10 centimeters in size or in length. In terms of the treatment that he had, if we are going back approximately 35 years ago, then the treatment that he had, which was traction casting, then that's also somewhat accurate, because these days we tend to treat things more with operative fixation, but in those days, traction and casting were the mainstay of treatment. So just to be clear, he has an open fracture and the bone is sticking out through the skin. In order to clean the wound and to close the skin, you're gonna have to do a reduction of the fracture. The step-by-step technique will be this. First, they're going to take him to the operating room. They're going to clean the edges of the bone so that there is no dirt that gets trapped into the wound or gets trapped between the fracture fragments. Then they're going to do what's called a provisional or a temporary reduction, where they pull the bones just enough to get them inside the skin. It's not going to be a perfect reduction, but it's going to be enough so that they can close the wound. Then, once they clean the wound and close the wound, because they're not going to treat this in an operative fashion, they're going to put some more traction on the leg, where they're pulling on it from end to end to make sure that it can be as straight as possible. While they're doing this, they're gonna check it with x-rays to make sure that it looks like it's almost or nearly anatomic. When they're satisfied with the reduction attempt, they're either going to put traction pins, a pin through the leg onto which they can attach weights, which will be used to keep the leg out to length, or they will cast it in the position in which they have reduced it. But either way, they're going to have a temporary reduction, and then once they're satisfied with their reduction, they are going to cast it or immobilize it. In this case, he said that he was casted for approximately 4 weeks. And that's a little bit short, but keep in mind he's only 4 years old, and young children heal faster than adults. Typically, in an adult, fractures like this, if they were closed, would take approximately 6 to 8 weeks to heal. If they're open fractures, they can take significantly longer. And I've said this in other videos, sometimes open fractures can take as much as 9 to 12 months to heal, especially if they are significantly comminuted or if the wound is significantly contaminated. In this case, he said it was about 4 weeks, which is a little bit on the short side given that it was an open fracture, but again, he's young and young children heal like gangbusters. After it's healed, he said that he required approximately 6 weeks of physiotherapy. And this also makes sense because if he was treated in traction and casting, this would have meant that he would have had a long leg cast applied, which is a cast that goes from his toes all the way up to his hip. And usually with this type of cast, your knee is bent in approximately 15 to 20 degrees of knee flexion or bend for the duration while it is casting. So after 4 weeks with your knee and ankle in the same position, you can imagine that both your knee and ankle are going to be stiff. So you will usually require some physiotherapy to get those joints moving once again. Timmain also mentions that the scar on the front of his leg covered a large extent of his right shin, and he noted that it was completely devoid of nerve endings. In other words, I think he's trying to say that it is numb and it has no feeling. And this is also something that we might expect. If the concrete spire came down and was heavy enough to break the skin and cause an open fracture over his shin bone, then it is also likely that it damaged nerve endings in this area, and those nerve endings would have been cut. So he would have normal sensation up to the level of the scar, and then beyond the level of the scar, his sensation would be altered. It is interesting to know that over time, his body would have developed some peripheral sensation from some of the other nerve endings around the area of the scar or the wound that had not been damaged. So some of those peripheral nerves would pick up some of the sensation in that area. However, there would still be an area that would be persistently devoid of sensation, likely for the remainder of his life. The last thing that Timmain says is that the muscle that runs down the front of the shin was deformed and continues to have comparatively huge dent in it even to this day. And again, if you were to have a large object fall on the leg and it was enough to crush the bone, then it was also probably enough to sever the muscle or cut through the muscle in that area. And certainly there would be an area of muscle that was necrotic or that had been killed by the weight of the spire coming down on the leg. So likely some of the fibers would have been damaged and there would have been a loss of muscle bulk in the area where the wound had occurred. That was a great story, Timmain. Thank you very much for sharing that with us. I hope that you are healed up and you are back to normal by now. And as always, that's the word from Dr. Chris, not your everyday ortho.
Okay.